I'm going to show you exactly what to do when your low back feels stiff and tight and any kind of movement feels like just too much. Step one, find a position that you are most comfortable in. It could be sat in a chair, it could be reclined back, it could even be laying down. And all we want to do first of all is start to learn to relax. Because when pain flares, your breathing shallows, everything tightens up. You might notice your abs are super stiff, your shoulders have come up, your breathing's extra shallow, your low back is just as tense as it can be. We want to get those things to come down. And we do that by just learning to relax and deepening our breathing. So find a position that you're comfortable in, allow your muscles to start to relax by doing some deep breaths. Let the shoulders drop, let your jaw unclench, let your abs relax, let your low back relax. Do this for just a few minutes. This is the first step, and it's a lot more useful and effective than a lot of people realize. Step two, I'm going to start to get into movements here. So a really useful one I use with a lot of patients is a pelvic tilt. So it's a really small movement and you can practice it in any position, sitting or standing. So we'll do it sitting to start off. First of all, find your hip bones and put your finger and your thumb on the edge of them like this. And then what you want to do is tilt your pelvis to stick your belly out and arch your back, and then do the reverse. So you're slumping in your chair. So slumping forward, pulling your belly in, and going in between those two positions. If at first it just feels like you're moving half an inch, that's absolutely fine. As long as you're trying to get more and more into that motion, you're doing the right thing. And then we can do the same thing in standing. So standing, feet shoulder width apart. Again, fingers on the crest of your hips there, and just trying to tilt the pelvis forwards. Again, sticking your belly out and arching your back, and then tilting it back. And just practicing going between these two positions. And there's no sets and reps here. It's just trying to build the amount of movement that you're comfortable with doing. And if it feels a little bit sharp, just reduce the amount of movement a little bit. But we should be able to build it up slowly. Doing this a few times a day can be really helpful for easing that low back pain. So on top of doing that pelvic tilt, which gets us into flexion and extension, we want to do a side bend. So again, a small motion just to start off, hands on the side of your thighs, and just trying to get more and more movement from left to right. Maybe a couple of inches of movement to start off, if that's what you're comfortable with. And as you get more comfortable and more capable with it, getting further and further into those ranges of motion. Again, no sets and reps here. A few times a day can be really useful. And then into the third plane of motion that our spine's capable of, and that's rotation. So trying to keep the pelvis still here, so we're not twisting the pelvis. What we want to do is move from the spine. So the pelvis stays facing forwards, and we're rotating. Sometimes this is easier when we're sat down as well. So trying it in standing, if that's too hard, try it sitting down. And just trying to get the shoulders to rotate and keeping the pelvis forwards. Again, if you want to start with a small range of motion and build up, that can be helpful. So now that we've built some of that small range of motion, we can start to build into a bigger range here. So doing a forward bend can be really useful. Literally putting your hands on your thighs to support you here, if bending forward is too much, can be really helpful. A little bend in the knees, and then as you come down, you're sticking your bum out. But we are trying to round our back. It's not a hinge. We're not hinging from the hips. We're trying to round the back. And just letting your body drop down. And it's almost like a stretch when we're just alleviating that pressure in the low back. And then slowly working our way back up. And again, if you want to help yourself with your hands on your thighs, it can be really useful. Again, no sets and reps. Just practicing this to get things moving. Doing these few small movements can be really useful when things feel really worked up and tense, just to get them to calm down and get back to normality. So practicing these a few times a day can be really helpful. I'm Barney, I'm a physiotherapist who's worked with thousands of people with back pain. And if you found this useful, then subscribe for more content like this.